March 15th is Kick Butts Day. If you've been looking for a date on your calendar to quit smoking, grab your red pen and circle March 15th. The American Lung Association reports that smoking is the #1 preventable cause of death in the nation, numbering 480,000 deaths per year. Cigarettes contain more than 7,000 chemicals, including arsenic, lead, and tar. Nearly 70 of those chemicals are thought to cause cancer. But there's another disease smoking can cause. Ed Neuzil, board-certified nurse practitioner at the Allergy, Sinus, and Asthma Family Health Center, explains COPD.
Well, COPD is actually a chronic obstructive pulmonary disease. So this is something that goes over a period of time, and it can include things like asthma, chronic bronchitis, emphysema. So it's kind of a cover term in the fact that a person's airway does not actually return to a normal state after we give them a bronchodilator. So our gold guidelines that we look at that will assess as to whether somebody falls into the range of COPD, and then when we look at their spirometry, due to the severity of what we say their FEV1, that will tell us how severe the COPD is. One of the links that we have between COPD and asthma, people can end up with COPD and not just from smoking. Now that doesn't mean smoking is okay, it just means that it's more prevalent because of the irritation that it causes to the airway. But we also have to understand that asthma causes irritation in the airway, and if we don't resolve the inflammation, then it begins to scar, and it's something they call airway remodeling. And it's where you start to change the inner lining of the bronchial tubes to where they form more of a scar. And as they become circumferential, which means they get around the entire diameter of the airway, scars have a tendency to constrict. So as it constricts, now it reduces the diameter of the airway and result in COPD. So when we look at young people and we detect asthma, it's prudent to really look at the fact that if it's left untreated, we can be developing COPD at later age.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click the Smoking and COPD tab on our homepage, yourhometownhealth.com.